Hi, my name's Dev. I'm a specialty doctor working in mental health in Bassetlaw. I'm going to talk to you today about some of the signs and symptoms of depression and also of anxiety. Now, the symptoms I'm going to talk about can occur in normal life anyway. When it becomes a depression is where these symptoms are present for at least 2 weeks. The first symptom people may be more familiar with is a low mood. Now, this can happen ongoing in the same sort of way, or it can be that the mood progressively deteriorates. It's very different from one person to the next, and no two people feel it in the same way. Low mood is the one symptom people know the most about, but it's only one out of a whole range of symptoms. So another problem people can have is what we call technically anhedonia. Essentially that just means not enjoying things that previously you may have done. Typically people who are depressed don't do the things that used to make them happy. And the reason being the enjoyment that they used to get out of this, they no longer get. It could be something as simple as watching TV, watching the football, playing football, doing sports, or any hobbies or interests that you may have. Often people won't know why they don't want to do it, they're just aware that the enjoyment isn't where it used to be. Something people complain about often is sleep disturbances. Now these can manifest in two ways. Some people will have what we call initial insomnia, where the first portion of sleep is affected, and some will have early morning waking, where the latter part is affected. Early morning waking is where your sleep finishes about 2 hours before you'd want it to, and initial insomnia is the initiation of sleep, it's getting to bed in the first place. Often people won't know actually what it is that's woken them up, and we often hear patients say, I just got up and I couldn't get back to sleep again. And this is quite common with people who have the sleep disturbance. As well as sleep, appetite is also affected. Predominantly, people suffer with decreased appetite, where they might find their belts are a bit loose, or their clothes get a bit baggy, or people just start to comment that they're losing weight. Other times people may start to eat more and can actually comfort eat in order to try and put their mind on other things. Another thing that people don't want to talk about as much is the effect on your libido, your sex drive. Often with depression, people have less desire for those sort of activities. It may be things like full sex, but it could also be things like kissing that you no longer want to pursue. Concentration can be a big problem for people, and it may be that when they're conversing with others, they struggle to keep their mind on the topics. It could be when they're out with friends, with busy environments, they're struggling to interact. It could be as basic as watching television or reading books, however. Earlier I touched upon the sleep disturbances that you can have with a depression. However, it's quite important to note that as well as the disturbance to sleep at night, you may find that during the daytime you're feeling a bit more tired, less energy levels, less motivated than usual. And again, this is quite typical in depression. People might find they stay in bed, stay in pyjamas, just lie on the sofa watching TV, not really taking it in, dozing in and out of sleep. When people are depressed in mood, often they find it quite difficult to interact socially with others. This is something we call social isolation. It can be that people stay in their bedrooms, in their own homes, but often it means that people struggle with the interaction with one person to another. Sometimes people we speak to spend the majority of their time on the computers in their bedroom, and often this is a form of social isolation as well, as they don't want to interact face to face and they find that quite difficult. People who are depressed in mood can sometimes have what we call pathological guilt. Now this means that they feel guilty and usually have low self-esteem and a poor self-image. And often it's for reasons that aren't really there, or that they've inflated themselves. Sometimes it's because they worry that they've put a burden on family or friends around them who are trying to care for them. When people have these thoughts, usually it's them that see this in a certain light and the family and friends around them don't. Often people are there to support one another. However, it can feel very different when you're in the situation itself. One of the big symptoms that people tend to know about are suicidal thoughts. Now, although this is quite a serious thing, there are a range of similar things that people can experience that can also be a symptom of a low mood and a depression. We have something called ambivalence towards life. Now, this is a medical term for basically saying you kind of don't want to be here anymore. It's not saying you're actively going to harm yourself, but more along the lines of you want to go to sleep and not wake up, or you want the earth to swallow you whole, or that simply you just don't know if you want to be here anymore at all. On the more severe side, there are suicidal thoughts, and this can be where you make plans to end your life. It could be that you're having recurring thoughts about it. It may be that you've thought about self-harming or injuring yourself in some way. These are quite significant symptoms, and if any of these are present, then it's very important to seek help. Some of the symptoms of anxiety include palpitations, tremor, feeling sweaty, not wanting to go out and about, nausea, butterflies in the tummy, headaches, dizziness. It's quite an array of different things. Usually the symptoms are triggered by something specific. It could be going out, it could be being in a big social interaction, it could be something as simple as going to the supermarket. And at these times the symptoms will tend to flare up. It could be that patients come and say they simply can't do it anymore, they can't go out by themselves, or they can't go out anywhere busy as they get too overwhelmed by the situation they're in. Sometimes people will come to us and say they're having panic attacks. Now these are essentially heightened forms of these symptoms that can happen in certain situations.